My name is Pierre. I'm coming from Rwanda. In our normal life, you can have the same, or you can access the same telephone as the one that other developing countries have. You can have the same TV set, you can have the same shoes or other things that you need. But for psoriasis, it's totally different. Though it is known like a global disease, we cannot have an equal access to drugs or to treatment. People are not aware about psoriasis here in Rwanda. Mostly in rural areas, people are not aware of psoriasis. And even people who are in the hospitals, they are not the dermatologists, they are not aware about psoriasis. It was affecting my life because in most of the time, you are embarrassed by people who ask to you what happened to you, and you do not have a response because I do not have explanation. And also there are some people who think that it is contagious because of fearing to be asked a number of questions. You start thinking on not going on a number of ceremonies or sport activities. You start isolating yourself. In the rural areas, we have a number of people who believe in traditional cultures like being cast, witchcraft, things like that. When you have something that is not normal, people start thinking that maybe it's a curse, maybe it's witchcraft, or is someone else who is harming you. My wife is aware of what is happening. Once I explained to her that it is a known disease, she do not manage to believe that. There is a tendency to believe that maybe there is some witchcraft or some traditional harm, things like that. She's very supportive. She accepted my skin. She's aware that it is not contagious. It is non-communicable disease. She's not afraid of approaching me. I opted to go to Nairobi because in that time, 8% of my body was full of psoriasis. It was hurting. I was not sleeping for that time. The entire bed in the morning was full of blood. I opted to go to Nairobi to look for biologic injection. It costed me 5,000 USD. Entire year salary that was being taken for that biologic injection. Rwanda has made an impressive growth in terms of access. We have a number of health infrastructure. Each state has its health centers, but the main challenge is the number of doctors and also the access to drugs, because our national health insurance does not have a capacity to pay for all specific drugs. Those people who are affected by skin disease, like psoriasis, are paying drugs or cream on their own private money. And even when you have means to buy those drugs, there isn't a number of pharmacies that you can find those medicines. For example, we have one pharmacy in Rwanda where you can find those kind of medicines. If the pharmacy has not ordered them from outside, in that case you spend like the entire 2 or 3 months waiting without getting those drugs. Currently, I have 2 people that I'm supporting. The one is the boy in the rural area that I have known through social media. And also there is the second one that also I'm supporting. The way, as you can see, hospitals do not have drugs or cream for that or ointment that you can use. You need to buy them on your private means. And the people here cannot afford to buy cream and ointment or other related drugs on their private means. I'm supporting them within my means, and I'm supporting them financially. I keep thinking that there is something that can be done by the entire world community, by our government, so that people can have an access to medicines.